The deadly virus that was declared eliminated is now back and haunting the United States.
A second child has died in a rapidly spreading measles outbreak in Texas. Nearly 500 people have been infected in the state since January.
The children aged just 6 and 8 were unvaccinated. An unvaccinated adult has also died.
Deaths are the first from the disease in the United States in a decade. Measles was declared eradicated in America in the year 2000, but officials fear misinformation over vaccines is fueling public scepticism and a resurgence of the disease.
And it's on the rise with recent outbreaks in the UK, Canada, Southeast Asia and Australia. So what does this mean for New Zealand? Should we be on high alert?
Are we worried? Yes. Are we going to see measles again? Yes. Will we be able to stop it in New Zealand? Well, that really depends how many of our population are protected.
Kia ora, I'm Amanda Gillies, and on The Detailed today, the return of highly contagious measles. We look at the deadly outbreak in the States, the impact for New Zealand, and the remarkable about turn by a high-profile American, so-called anti-vaxxer.
Health Secretary Robert Kennedy Jr. has taken to social media to endorse the use of the standard MMR vaccine. That's despite having a history of skepticism over their use.
I think the U-turn is really important. I think that people in power need to be more honest in their conversations, and if they want to lie about the science, then they should be challenged. And he did not have his science right. His science was wrong. Now, I'm grateful that he's pulled his horns in, but I think the damage is already done. The evidence behind vaccination programs for measles is so overwhelming. You know, there are no doubts about it. We know the safety profile of the vaccine. We know the myths. So people sometimes are just playing their own games. They're being malicious, but, you know, they're not being honest to the clear evidence base. I'm glad he's pulled his horns in, but he's already done a huge amount of damage.
That's Wellington doctor and Principal Medical Advisor for the Immunisation Advisory Centre, Nikki Turner. We will have more on RFK Jr. a little later, but first, what is measles and why is it back overseas?
Measles is a virus. It's a highly contagious virus. It's probably the most contagious virus we know. So if you're standing in the far corner of a room and somebody walks in, you'll catch it. That's how contagious it is if you're not immune to it. So measles can be very nasty. So prior to having vaccination programs, pretty well every child was exposed to measles in childhood. It starts like a cold, a runny nose, you get sore eyes, you get a widespread rash. And then about 10% of people go on and have complications from it. Now, before we had vaccination, pretty well everybody caught measles. About 1 in 1,000 would get infection of the brain, of which about a quarter of those would die. A third of those would have some sort of permanent brain damage. And for the rest of the children, after you've had measles, the virus actually suppresses your immune system. So not only do you have a whole pile of consequences from measles, but for many months and sometimes years afterwards, your immune system is not so good and you get lots and lots of other infections. So it's a ghastly disease. It has killed millions and millions of people unnecessarily throughout the world.
It seems, though, like such an old-fashioned virus, and one that I thought, no pun intended, that we had killed. So why in 2025, why are the measles back and killing again?
Yeah, so what we absolutely know is vaccination programs work. In fact, we have good World Health Organization evidence that measles vaccination program over about 50 years have saved nearly 98 million people from dying. So it's eye-watering. And many countries in the world and regions in the world have actually eliminated measles. If you have high enough vaccination coverage, you never see the disease. So, for example, South America has no measles unless somebody comes in on a plane or a boat and brings it in. Those countries have control of measles. New Zealand has no measles right now in our country. But the moment Somebody is unvaccinated, non-immune, they catch the virus, they bring it back in. So if you've got a highly vaccinated community, it doesn't spread and you never see measles. The reason why it's coming back now is because vaccination rates are dropping off, particularly since COVID in many parts of the world. It's a tragedy. This is a virus we should never, ever see in our world. It's preventable, totally unnecessary to have in countries.
Obviously, it's huge news in America at the moment. So how concerned should we be about what's happening over there with their outbreak?
Yeah, so New Zealand measles is only one plane flight, one boat trip away. That measles is increasing in quite a few countries at the moment. In war-torn places like Yemen, there's a lot of measles. In countries like Pakistan, India, there's a lot of reservoir of measles. America previously did not have community transmission of measles. So this is a reflection of dropping vaccination rates. Are we concerned? Yes, we're very concerned. And what will stop New Zealand catching measles is having enough of our population immune across the population. So if we have small groups anywhere in our country with low protection, measles will return and transfer from person to person. So not only do we need high immunisation coverage, but we need it consistently across all parts of our country. And that's the problem. Often you've got small areas within your country that might have lower immunisation coverage than others. Sometimes you have groups of adults who cannot remember if they had measles vaccination when they were young or not, so are unaware they're at risk. Are we worried? Yes. Are we going to see measles again? Yes. Will we be able to stop it in New Zealand? Well, that really depends how many of our population are protected.
All three who died in America were unvaccinated. The two children were from Texas, where the outbreak started in January. It's already spread to Oklahoma, Indiana, Kansas, Ohio and New Mexico. A decline in vaccination among US children in recent years, fuelled by unscientific claims that the shots are unsafe, has been blamed for the growing outbreak.
An 8-year-old girl laid to rest after she contracted measles. State health officials attributing her death to pulmonary failure from the virus, in a statement saying the child was not vaccinated and had no reported underlying conditions.
Another unvaccinated child in Texas died of measles in February, which was the first measles death in the nation in a decade.
The only reason those children have died is because measles has come back into the country because less people are accepting vaccination. That is why kids end up in hospital. That is why kids die. That is just wrong. It's so wrong. And it's from misinformation. Some of it's maliciousness, some of it's confusion. And in the end, it's the kids who suffer.
Some of that misinformation was spread by people like US Health Secretary Robert F. Kennedy Jr.
Kennedy turned heads as President Trump's pick to lead HHS. For decades, he has been a vaccine skeptic and promoted the bogus claim that they cause autism.
Health Secretary RFK Jr., who has said in the past that measles can be good for you if you get over it, well, this young girl did not get over it.
He's referring there, of course, to the young unvaccinated girl who died in Texas. RFK Jr. has now met with her family and he's done a remarkable U-turn, encouraging Americans to now get the MMR vaccine. He was grilled on this by CBS News in America.
It's one thing to say the measles vaccine is the best way of preventing spread, but it's another thing to then say, and therefore, we suggest that you get the measles vaccine.
We encourage people to get the measles vaccine.
Okay, so I think that's actually the next step, and that's news as far as I'm concerned, that you're saying that. What's the position philosophically of the federal government in terms of public health?
The federal government's position, my position is people should get the measles vaccine, but the government should not be mandating.
Understand.
No, but I've always said during my campaign and every public statement I've made, I'm not going to take people's vaccines away from them. What I'm going to do is make sure that we have good science so that people can make an informed choice.
RFK Jr., of course, famously travelled to Samoa the year of the deadly measles outbreak there in 2019.
These are terrifying times for the people of Samoa, told to stay indoors and the vulnerable ordered to mark out their homes in a medieval-like practice. Samoa's government has declared a state of emergency but stands accused of acting too late.
Children are dying in front of us, in front of them and in front of other families in the intensive care unit.
In total, 83 people died, with 5,700 cases following decreased vaccination rates there, which RFK Jr. reportedly endorsed during his trip there. Earlier this year, during a Senate hearing, he was pushed for answers for his past comments on vaccines and about the part he allegedly played in the outbreak in Samoa.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You made almost $5 million from book deals, mostly promoting junk science. In 2021, in a book called The Measles Book, you wrote that parents had been, quote, misled into believing that measles is a deadly disease and that measles vaccines are necessary, safe, and effective. The reality is measles are in fact deadly and highly contagious, something that you should have learned after your lies contributed to the deaths of 83 people, most of them children, in a measles outbreak in Samoa. So my question here is, Mr. Kennedy, is measles deadly, yes or no?
Let me explain what happened in Samoa. In Samoa, in 2015, there were 2 kids who died following the MMR vaccine. And the vaccination rates in Samoa dropped precipitously from about 63% to the mid-30s, so they've never been very high. And in 2018, 2 more kids died following the MMR vaccine, and the government of Samoa banned the MMR vaccine. I arrived a year later when vaccination rates were already below any previous level. I never gave any public statement about vaccines. You cannot find a single Samoan who will say, I didn't get a vaccine because of Bobby Kennedy. There are 83 people died. When the tissue samples were sent to New Zealand, most of those people did not have measles. We don't know what was killing them. The same outbreak occurred in Tonga and Fiji, and no extra people died.
The nominee wrote a book saying that people had been misled into believing that measles is a deadly disease. He's trying now to play down his role in Samoa. That's not what the parents say. That's not what Governor Green says. It's time to make sure that we blow the whistle on actually what your views are. At least we're starting.
Don't forget that the same year Samoa battled measles, 2019, it arrived back in New Zealand.
2 people have been diagnosed with measles in Auckland as the number of people with the disease in Canterbury has hit 28. This comes as vaccine supplies run low and more have had to be trucked in from Auckland. Some of those are being distributed to Christchurch GPs as we speak.
Now, we were declared free of measles in 2017. What happened in 2019 when it came out? How did we get that back under control?
Yeah, so what happens is you got measles introduced from somebody on the outside, came into Auckland, and because there were groups within our population where they were not protected, the virus was able to move from person to person to person because it's so highly contagious. Now, we got quite a big outbreak, but we did actually manage to control it. And the reason we controlled it is because the virus can only spread to non-immune people. So there were enough people as that virus tried to spread that ultimately stopped it spreading. And so we got on top of the outbreak, as a result of which we actually have managed to keep our elimination status. Luckily, because what it means is we now know right within New Zealand community today, there is no virus transmitting between people. But what we learnt from that time, and we've had several other breakthroughs since, is that one virus arriving in this country can easily spread again. So it's going to happen again. And really how bad it is will be about whether the virus can happily spread or whether it hits a block from immunity and dies off.
Oh, we're hoping for the latter. But how prepared, though, Nikki, is our healthcare system for a possible measles outbreak?
Yeah, I don't think we're very well prepared at all. Firstly, it's so highly contagious. It's way more highly infectious than COVID or flu or any of the other big viruses we're worried about. So it's hugely infectious, so it's easy to arrive. Secondly, a lot of adults are unaware if they're protected or not. So there are quite a few adults walking around who may be able to spread it. And thirdly, our childhood program got hit really badly, particularly with COVID, and our rates have dropped off. So there's an urgency that I know that all the health services are working incredibly hard to try and support communities to increase the vaccination coverage again. But of course, with the situations internationally, the difficult politics, anti-vaccination people getting airtime, telling straight lies, it's very hard for people to have confidence and to believe that vaccination is what is going to stop measles, because that's what it's all about.
So what is the current measles vaccination rate here? I mean, is it enough to protect us?
No, it is not enough to protect us at the moment. Generally, it's said if 95% of your population was vaccinated with 2 doses, you would be very unlikely to have measles transmission. New Zealand got quite close to that prior to COVID, but our coverage rates have dropped off now. And now really for the first dose of measles-containing vaccine, we're actually under 90%. So firstly, yes, our coverage rates are too low. Secondly, a lot of adults may have missed out on measles-containing vaccination when they were young and are not always aware of that. So we've done a lot of catch-up. A lot of people have gone and had an extra vaccine, but many people may not know. And then thirdly, it's not distributed evenly. So there are some parts of New Zealand where immunisation coverage is lower than others. Sometimes people coming from areas of poverty are less likely to manage to have got vaccinated. Some people are anti-vaccinated in specific communities. And of course, they're at very high risk if the whole community is unvaccinated.
Gosh, you just touched on then, because I'm a 70s kid and there was no MMR, the mumps, measles, rubella jab back then. So what should I do? Do I need to go get a jab, and how easy is that?
Yeah, so if you don't know your immunisation history, and that's particularly for people, pretty well any of us under 50, because older people would have been exposed to the measles virus. So on the whole, older people are not at high risk. They've probably survived measles when they were young and they've still got protection. But for any of us who are a bit younger, if your parents don't know your history, if you don't have your Plunkett or records or anything, then the easiest thing is, if you're not sure, it's actually really safe to go and get another vaccine. If you actually were immune, then your body will just deactivate the vaccine safely anyway. So there's no safety concerns in saying, oh, I'm not really very sure, and going and getting another vaccine. It's actually, you cannot overdose.
COVID, she says, has played a detrimental role in our vaccination rates.
With the onset of COVID, the disruption to our health services, the confusion for our communities, I think the legacy of people being very angry about mandates with COVID vaccines, unfortunately, has spilled over into the effect on the childhood vaccination program. And so we've had a much more precipitous drop-off in coverage since COVID.
And for parents who are thinking, no, I don't want to get my kids vaccinated, for various reasons, what's your advice there?
Well, there's 2 different issues. Firstly, for individual protection, the evidence is very clear. Measles is a nasty virus and your child could be very severely affected by it. That's the first thing. The second thing is, this is a community one. This is not an individual protection one. If you do not vaccinate your child, not only is your child at risk, but they could spread the virus to others. And yeah, I've said that about 10% of children have nasty side effects from measles, but for children who have a problem with their immune system, adults too, such as those who are on cancer treatment or they're on drugs that affect their immune system, if they catch measles, they have got a really high death rate, like up to 50% could die. So not only are we putting our own families at risk, but really, if those unvaccinated children are in preschools, are in schools, then they run the risk of spreading infection to others. And the children who are at really high risk, who have poor immune systems, themselves can't have the vaccine because it's a live attenuated vaccine. So we can't give it to those children. They are reliant on the rest of us looking after them. So this is not a story about me protecting my own children. This is a story about us as New Zealanders wanting to protect our communities. So we're all in it together.
Once you get the measles, how easy or hard is it to treat? And is a dose of vitamin A enough to cure it, as advised by RFK Jr.?
So I think he's mixed things up a little bit, so that I have worked in low-income countries and countries where the situation's very challenging, and children who are undernourished are often low in vitamin A. And so we certainly give vitamin A to those children, and we use vitamin A as a supportive treatment in hospitalised measles because it helps. It helps. But a well-nourished child with a good diet is very unlikely to be vitamin A deficient. So yes, you can use vitamin A to help measles, but it is not a cure. And it's certainly not going to prevent you getting measles, and it certainly cannot prevent you getting severe problems. The other sad thing in the States is because they're over-promoting the role of vitamin A, they're actually seeing vitamin A toxicity problems now quite often. My colleagues are telling me that these poor kids are coming in with damage from vitamin A. So, it's once again, it's getting the messages wrong. Yes, vitamin A has a place and a role, but it is not going to treat all measles, and it's certainly not going to stop measles.
Best treatment. You get measles, what's the best thing to do?
Yeah, so it's a virus. We don't have any good antivirals that work against it. We have what we call supportive treatment. So one aspect of supportive treatment would be vitamin A. So if the child is not too unwell, or the adult, you can manage at home the same as any other virus, with lots of fluids, rest support, and making sure the infected person is not spreading to others is the main point. In fact, if they're in contact with others, if you vaccinate quick enough, you can often stop the spread. Many of our children end up in hospital. New Zealand hospitals do a fantastic service. And in the last outbreak, we didn't actually have any deaths. And quite frankly, that's down to our amazing hospital services. So as the children get sicker, they'll end up needing oxygen, they'll end up on drips, they'll have intravenous fluids. And if they get very sick, they'll end up in intensive care, being ventilated. And it's really supportive services to support them through the really bad time until they actually can get well from the virus.
I never had measles as a kid. Is it worse getting it as an adult?
Not necessarily. It can still be very severe as a child. See, when my mother talks about it, everybody had measles back then, so they took it as normal. But what was also normal is a lot of children died, and a lot of children got really sick with pneumonia, got brain damage, and that was just part of life back then. So no, you can have measles really badly if you're a child or an adult.
Right now, we're in the heart of the school holidays. So is it safe to travel overseas? Because as Dr. Turner mentioned earlier, America isn't alone in battling an increase in measles cases. In Europe, for example, more than 127,000 cases were reported last year, double the number in 2023 and the highest in 25 years.
So if you and your kids have had 2 doses, you're safe to travel. Kids who are too young to have started their first dose, I would be a bit more anxious about. So check the area you're going to, see if there's a lot of measles around. You can give an extra earlier dose to infants between 4 months and a year if they're going to areas where there's likely to be measles. So that's just some parts of the States, but many other countries. And then, of course, if you can't take an MMR, if you've got a compromised immune system for some reason, then you really need to get good medical advice and, talk it through very carefully with your health services.
She's confident that one day international travel will be measles-free.
We could fully eradicate it. We've done that for smallpox. We were close to doing it for measles, and coverage is dropping off. So we could do it. We just need international goodwill. We have a fantastic vaccine. We have many communities that have managed to stop measles spread. There is no reason why we should not be able to fully eradicate this virus internationally everywhere. It's just frustrating that we haven't, and our kids are suffering.
That's all for today. The Detail is a newsroom production supported by RNZ and New Zealand On Air. Thank you to Dr. Nikki Turner. This episode was produced by Gwen McClure and engineered by William Saunders. I'm Amanda Gillies. Mā te wā.